Hello, ladies and gentlemen. Welcome to Triple N Media. I am Dr. Nik Nikam. I have been a cardiologist in Houston area for more than 40 years. The focus of this presentation is warning signs of a heart attack. As a cardiologist, this is one of the most important topics that we deal with because it is a matter of life and death when someone is having a heart attack. So we're going to look at all the typical symptoms of a heart attack. There's no such thing as typical symptoms of heart attack, and the unusual symptoms which may signal that a person could be having a heart attack. And the unusual symptoms are of paramount importance because they could save your life. So please watch this presentation till the end of the video so that you learn some of the unusual symptoms that may signal an impending heart attack. And please do subscribe to our YouTube channel so that we can bring you a lot of educational videos with reference to heart and heart disease. So let us continue with the feature presentation. Chest pain is considered a typical symptom of a patient with a heart attack. The typical crushing chest pain, walking into the emergency room and gasping for breath is what is described in the historic books. But the chances of finding that are not 100%. Maybe 25% or 30% of the patients may present with typical crushing chest pain lasting for more than 30 minutes, associated with shortness of breath, sweating, palpitations, and dizziness. And of course, they need to be moved into the emergency room table, and the rest of the things have to be taken care of. But the typical pain is not always there. Some people may just feel some heaviness in the chest, some uneasiness in the chest, or some vague feeling in the chest they can't describe. They say, I was doing fine and all of a sudden I felt like something was gripping, tightness. So these are some of the symptoms or variations of chest pain that may signal the presence of a heart disease to begin with. Unfortunate story about chest pain is that 40% of the people who have heart attack don't make it to the hospital. Because when they have an acute heart attack with an acute coronary artery blockage, that leads to cardiac arrhythmias, which leads to cardiac arrest from ventricular tachycardia or fibrillation. As a result, they don't even get a chance to get to the hospital. Even if a CPR is done, only 10% of the people who are subjected to CPR really make it and survive. So the most important thing is recognize the problem before it becomes complicated or serious. So if you're having any type of uneasiness, tightness, compressions, or like a squeezing feeling in your chest for anything that you shouldn't be feeling, then you should consult with your primary doctor or a cardiologist so that it could save your life. The next most common symptom we hear is shortness of breath. I was able to walk from the parking lot to my office, but today somehow I just couldn't even walk 1/3 of the distance. I was so exhausted, I had to just stop and catch some breath. That could be a warning sign of a heart. When there's shortness of breath, that means the heart is not able to pump enough oxygen to the rest of the body to meet the oxygen demands. Why is the heart not able to pump enough oxygen? Maybe there's damage to the heart muscle. Some people may not feel pain. Patients with diabetes may not feel chest pain at all. They can have what is called silent heart attacks. It's important to pay attention to an unusual onset of symptoms like shortness of breath and a few other ones which I'm going to be talking about. So if you're feeling short of breath with the normal activities where you were comfortable before, then you should consult a doctor. Next thing is dizziness. Some people may feel dizziness during an acute reduction in the blood supply to the heart muscle. What happens during this time? This time the cardiac output may be reduced. The heart may not be able to pump blood as normally as it would, or there could be irregular heart rhythms, irregular heart rhythms that can cause dizziness, or anxiety can cause dizziness. But you get chest pain, oh my God, I'm having a heart attack. Then you're going to feel anxiety is going to take over. Then all of a sudden you feel like you're having a dizziness, or you may feel like the whole world is turning around and you can't even get balance. So these are some of the things we should be paying attention to. Next thing is heartburn. This is very typical. You talk to any middle-aged man or a woman, the first thing they say is, oh, I'm feeling a little uncomfortableness in the, I woke up in the morning, this uncomfortable feeling in the stomach. I had gone for a dinner last night. I don't want to pick on any restaurant, take Indian restaurant for matter because I'm an Indian, and ate all that spicy food. Now it looks like my stomach is hurting and I feel this heartburn coming back. And well, it may very well be due to the food, but it could also be a sign of a heart attack. So if the way I tell my patients is, if you are having symptoms in your chest or upper abdomen, anything that you shouldn't have, it's a blessing because it could be a warning sign of a heart attack. At least this will draw your attention to the medical experts, and hopefully we can find out what's going on and prevent you from getting a major or a fatal heart attack. Think about it. It's not always the Indian food causing you the heartburn, or the Mexican food causing you the heartburn, or the Italian food causing you the heartburn. It could be your heart itself. Next, when some people get a heart attack, chest pain may not be the main symptom, shortness may be the main symptom, but because of all these changes going on and anxiety, you may feel nauseated, and you may feel like throwing up. This is pretty common because this is like a panic attack where people get nausea and vomiting because of the anxiety created by an unusual feeling in the chest, or even just worrying about having a heart attack, even if you're not having a chest pain. Unusual tiredness. This is something which may be very subtle that may suggest a heart problem, because the main function of the heart is to maintain the adequate requirement of the body's oxygen supply. If the heart cannot meet those things, then you're going to feel shortness of breath, you're going to feel fatigue, you're going to feel tired, you're going to feel weak. When all these things happen, it could be an indirect sign that maybe there is trouble in the paradise, and that is in your heart. Cold sweat. Again, cold sweat. Why do we get cold sweat when we are having a heart attack? Very simple. When you are having a heart attack, the heart function is reduced. Heart may not be able to pump adequate blood. There could be a drop in blood pressure. And drop in blood pressure can lead to weakness, dizziness, shortness of breath, and of course sweating. If you are sitting in your office and you get a phone call, then you think, oh my gosh, I got this bad news. But it may be the bad news, but it could also be a bad news from inside too, from your heart. And all of a sudden you break out in a cold sweat and you're just trying to mop yourself, put on the fan and all these things, and it doesn't look like it's getting any better. You better call and get some medical help. Unexplained cold sweat could be a sign of a reduced cardiac function. So ladies and gentlemen, this is just like a quick overview of some of the unusual symptoms you can experience when you're having a heart attack, or someone else is having a heart attack. Let's put it that way. And we should pay attention to these symptoms, because I say blessed are those who have symptoms, because we have a chance to save them from having a more serious heart attack. I hope this has been educational to you. I have hundreds of videos on education with reference to heart and heart disease. Please do watch them, and please do subscribe to our YouTube channel, and I will see you in the next presentation.